Welcome to Listen to Your Skin by Moon and Skin, the podcast where science meets nature to celebrate the story of your skin. Your skin is a living canvas, ever evolving, deeply personal, and uniquely yours. Each week, we'll dive into the science of healthy skin, share empowering stories, and uncover transformative self-care rituals. We're here to help you embrace every phase of your journey with confidence and care.
Hi, everyone. Welcome back to Listen to Your Skin by Moon and Skin. I'm your host, Dr. Jen Haley, and I have my favorite dermatologist that's local to Scottsdale back on the show to talk about lasers today, Dr. Brenda Lutowski. Welcome back.
Thank you, Jen. Thank you so much for having me.
I love having you. So in all the ways of friendship and also fully respect as a colleague.
Thank you.
Of course, I want to talk about lasers. I think that in some respects, society is very familiar with lasers, and in some respects, not at all. So can you break it down? Lasers 101, what is a laser for the skin?
A laser is simply targeted light or focus light that goes into the skin, and then it's absorbed by something and it has its effect. And that something is called a chromophore. And so we have lasers that target brown, where something called melanin is the chromophore. We have lasers that target red, where something called deoxyhemoglobin is the chromophore. And then we have lasers that target water, where we're more interested in resurfacing of the skin. Excuse me. And so these lasers are very, very focused, and each one tends to specialize in doing a different thing, but we can really safely and effectively treat brown spots of the skin, red spots of the skin, including rosacea, scars, etc. And then we can resurface the skin, meaning create new collagen and therefore have some skin tightening and texture improvement due to the action of these lasers.
So lasers that address pigmentation basically they can treat hair, they can treat tattoos, they can treat sunspots, and the difference is based off of like how deep they go in the skin. So there's a lot of science that goes behind laser technology. And one of the things that I've seen so often over the last 20 plus years is people will often mistake that one laser can do everything. So what I want you to break down is kind of categories of lasers, if you can, and what they can do and what they can't do. Because, laser that's really good at treating hemoglobin or blood vessels, for instance, is not going to be the laser you want for wrinkles per se, necessarily. So I don't think people understand that. What I see often is these med spas will have one laser and they'll promise someone the world with that one laser, and they don't deliver, and often they cause scarring because they don't understand the science and the physics behind how the lasers have to work.
I think that's such a great point. There are so many different lasers out there, and sometimes it's hard for even me to keep track of them. We were talking about that offline, and that's because the number of lasers out there are because each laser can kind of specialize in a different thing. And the reason why you go into a practice, and sometimes it can be a little overwhelming because you look at someone's menu of services, like you can look at our menu of services, you see we have this laser, we have this laser, we have this laser. It's because each laser can safely and effectively best treat one category. So what are those categories? Like you said, there's laser hair removal, there's tattoo removal, and there are also lasers for brown spots. I would put those in a category. Lasers for red spots, I'd put that in a category, and lasers for resurfacing, just total rejuvenation. In addition, there's energy-based devices. So those also have little niches that they focus on. And so it can get very confusing. I think the key is, it can get very confusing to the consumer. I think the key is really finding a practice and an educated provider, whether that's a physician or someone working under the physician who can help to guide someone. And even if that particular practice doesn't have the laser that's going to be the best for that category or that condition, they can be a resource and refer them out to another practice who does have the laser.
Right? Okay, so I'm thinking as we're sitting here, because we previously did the podcast on Botox neuromodulators and fillers, and now we're talking about lasers, and then of course and other energy-based devices, and then we have things we want people to do at home, like skincare, or do with estheticians, maybe microneedling and chemical peels. Say I am 40 years old. I spent quite a bit of time in the sun. I've got some broken blood vessels on my face, some brown sunspots. We'll leave melasma out of this, just sunspots, because not all brown spots are created equal. Some brown spots, such as the ones I struggle with, which you've helped me with this, they can get worse with certain types of lasers. So someone who's able to diagnose your brown spots is very important, because I've seen litigations regarding someone making a diagnosis of brown spots and it being melasma or the hyperpigmentation or the brown spots after acne scarring, which respond very differently than sunspots to lasers. So, okay, I've got brown spots, I've got some broken blood vessels, I have some wrinkles on my face and coarse skin. Where do we start?
Oh my gosh.
And where does the budget kind of go with all of these things? If we could talk hundreds, thousands.
Yes. So I love doing this hypothetical situation because I just think it's so fun. This is what I do every day. It is so much fun. So I would start in this hypothetical 40-something-year-old patient with sun damage, and how appropriate since we're in Arizona. I would start by suggesting some laser resurfacing. In our practice, we have the Fraxel laser, which is my favorite skin resurfacer, if you will. And this is a laser that has 2 different wavelengths, and it focuses on heating the skin to produce collagen. And so the new collagen is going to cause someone's skin to look tighter, to look more exfoliated. The pore size will shrink because of the new collagen contracts the skin, if you will. And it just looks healthier and younger. In addition, the exfoliation that occurs as part of the healing from the Fraxel, and also most likely the intense heating from the Fraxel, it actually makes the skin healthier. So this device is FDA approved for the treatment of precancers or actinic keratoses. And it also has been shown to reduce the risk of non-melanoma skin cancers. So here in Arizona, I think it's really important someone in that age category start thinking about not only how they look now, but preventative modalities for the future. I think it's the perfect option. You mentioned capillaries. I have seen capillaries improve after Fraxel just because the health of the skin has improved. Although, speaking of chromatophores, it's actually not a laser that targets that chromophore. So if someone has ongoing capillaries, especially around the nose, cheeks, or chin area, then we have another laser in the practice that specifically targets those. And we would do that after the Fraxel.
At the same day or at a different day?
Typically, I will encourage for that particular scenario a different day because oftentimes those capillaries will improve when the skin gets healthier. So sometimes patients are no longer bothered by the capillaries after the Fraxel, but I will treat patients same day with multiple lasers, just depending on the goals that we want to achieve.
Okay. It's so interesting, and I'm going to admit this. I'm going to admit this because, I always admit everything. So I've had Fraxels with you every 6 months for years now, for 4 or 5 years. And I didn't even know it did all of this. And I keep thinking, I need to do something more heavy duty. But now I'm realizing why I don't think I have needed to do anything more heavy duty, because doing that consistently has really made a difference in my skin. And I didn't realize that it had all of those benefits. But one of the things I do notice after you do the treatment on me is, because I'm religious about wearing a hat, my forehead doesn't get much of a reaction. But even though I wear sunscreen very thickly and very deliberately, the lower part of my face where the hat doesn't cover, it definitely lights up more. Let's just say that. Is that typical?
That is typical. I also think it has to do with circulation issues and gravity issues as well. But for sure, I'm advising patients to stay out of the sun about a week to 10 days beforehand, longer for patients with darker skin, and then a week to 10 days afterwards. And you're so good and diligent about staying out of the sun, even though you have a very active lifestyle. But a lot of times we will actually postpone patients' lasers till the fall and winter and early spring here.
Okay, interesting. Yeah, I feel like now is a good time because people don't go out in the summertime. At least in Arizona, we're opposite other places as far as our indoor season. Okay, so the Fraxel's good for those things. What about photofacial or IPL? Are people still doing that? And what are the indications for that? Like, what's the ideal kind of patient?
So there is a device that looks and acts like a device, that like a laser, called IPL, intense pulse light, but it's actually not technically a laser. So we were talking about lasers being very specific bands of light or very specific wavelengths of light. IPL is actually broadband light, and we can put filters in it to make it act like a laser. So yes, to answer your question, it is being done very, very commonly, and it really, in my opinion, does well for brown spots, but it will help with red as well. Doing the IPL consistently actually can keep the skin really tight and healthy, as well as helping the brown and red spots. So in my practice, if a patient doesn't want to do Fraxel, they don't want to have the downtime for Fraxel, you will hear me recommend the IPL treatment and recommend the IPL treatment a couple times a year. I think it's a really, really great treatment for patients who don't want any downtime, like for a stronger skin resurfacing treatment.
Okay, so IPL or BBL is another name brand, right?
Mm-hmm.
That's
Yes.
a lighter kind of treatment.
Yes.
Less downtime, usually less reward.
That's correct.
Okay. Okay, so we've got those two covered. Now, if someone is looking to do laser hair removal, I don't know if you still see this. I know when like laser hair removal first came out and we were doing it 20, 25 years ago, people didn't seem to understand that if you have red hair or if you have blonde hair or your hair has to be darker than your skin. So even if you're African American, as long as the hair is darker than the skin, we can target the hair versus the skin. We don't want to burn the skin in the process of getting rid of the hair. Is that the same as the lasers nowadays, or do we have better technology for addressing hair removal? And are people still doing a lot of hair removal?
People are still doing a lot of hair removal. It's extremely popular. And yes, we are still met with the same challenges in hair removal. It still works the best on dark, coarse hair. That's like the ideal hair removal hair, if you will. And the finer it is, the harder it's going to be to get rid of. The lighter it is, the harder it's going to be to get rid of. And I do tell patients, if it's white or light, nothing's going to work at it at this point. We do have technology that's actually FDA approved, but it's not available in the US at this point. That may make a difference with light hair, but time will tell if that's going to be a widespread treatment here.
I think we'd have to learn to pigment the hair bulb, wouldn't we? And then target the pigment in the hair bulb, because hair dye is not going to work because we're not getting it in the bulb.
You're right. There's no melanin there from the dye. This particular technology heats the hair follicle in a way that the hair follicle becomes extremely heated without having the chromophore there.
It kills the root. You're not just tearing like the upper part of the grass. You're getting the root out.
Exactly.
It's the only way. Okay. Okay, so we have hair removal. What about tattoo? Because I think, over the years, those little gang tattoos you see that are put in by amateurs, those are fairly easy to remove. They take one or two treatments. But for the most part, I find that the multicolored tattoos can be quite challenging to remove. What kind of guidelines do you give people, and what should they look for if they're looking to do tattoo removal? Because when I used to do it, it was a lot of treatments and quite expensive and quite painful.
That basically still sums it up. It's always more expensive to get rid of the tattoo than it is to get the tattoo by many fold. Tattoo removal is still met with challenges. Part of the technology that makes tattoo removal successful or not is the speed with which the light is going into the skin. And so nowadays there is a type of laser called a pico laser. And that usually is done with more success than some of the older lasers. Although I have heard cosmetic doctors going back and forth, even with some of those older technologies, if the pico laser isn't working. We don't currently do tattoo removal in my practice. So if you came in with a tattoo, that's an example of when I would refer someone out to a trusted physician to do that tattoo removal for you. But it is fraught with challenges. One of the challenges is actually what's in that ink that we're seeing in the skin, and the different proportions of ink. Each artist out there is just that, an artist, and has different concoctions, and that can translate into an unpredictable tattoo removal experience.
Do you remember I think it was out of Boston, one of the main laser guys in our world had created a tattoo ink that can be removed with one laser treatment. Do you remember that years ago? And no one took it because it's like art. Imagine creating art and then knowing that somebody can erase it. Like no tattoo artist wanted to take that on.
That's a really great perspective. I do remember that.
Right.
And it is kind of sad that technology was kind of a flop. But I think most tattoo removal doctors would really, really love it if people would just use that ink.
Right. I mean, just as someone who's seen thousands of people naked, I love asking the story behind the tattoo and asking the story behind somebody's scar, because scars and tattoos tell stories of our lives. And we also see that people have so many tattoos that they wish they didn't have, because what you believe at one time in your life, you don't believe 20 years later. So there's pluses and minuses to everything always.
For sure.
Right. Okay. So we talked about pigmentation. We talked about photofacials. We talked about hair removal. We talked about tattoo. We talked about removing or helping reverse some sun damage with the Fraxel. Say I've done 2 Fraxel treatments. I'm still dealing with some coarseness of my skin, some more sun damage, and I want to step it up. Where would somebody go from there?
So there is a laser called the CO2 laser that is more aggressive than a Fraxel laser, which is a non-ablative fractional erbium laser. So there is an ablative laser called fractional CO2, and it will give the patient more downtime. It usually costs more money, and it for sure hurts more. But that is a laser that's more aggressive than the Fraxel. Now, is it worth it or not? It depends on each individual and their skin.
Right. Okay. We used to do that under general anesthesia, and that was the days where we overdid it and people had the porcelain doll faces. You know, I think things have gotten so much more balanced and natural nowadays, where we understand we need to do multiple treatments of something without being so aggressive to keep like everything is natural looking.
I think safety is always first. Mm-hmm. So the traditional CO2 was ablative and non-fractionated, and to your point, was fraught with complications. I've seen so much scarring out there. Like you said, porcelain doll face, hypopigmented scarring, infections that had occurred, and even hypertrophic scarring, meaning the scars are raised, especially around the jawline. From there, fractional CO2 was developed, and that's a much safer technique. However, the results are not the same. And so, to your point, they need to be done more frequently. And unfortunately for the patients, that means more downtime, more costs, but it is a safer way of doing things. And I think ultimately that's the goal.
Right? I agree. Okay, so what about, I hear these words. So we talked about Fraxel, Pixel, Tixel. What's Pixel and Tixel?
Oh my gosh, there's so many terms. There's so many lasers out there. I can't even keep them all straight anymore. So there are so many competitors. And I think for most people, just going to someone who has those categories of laser treatments.
Because there's names even under the category. So each category is a category, but then there's different names under there.
Exactly.
It's hard to keep up with.
It is. And that's where you really have to trust your laser doctor and trust that they are investing in the best devices for their patients' interests.
Okay, so what about if somebody was on a GLP-1 analog, they lost some weight, and now they're noticing some sagging around their face? I know there's huge variations in how much sagging people have, and there's only so much devices can help with or filler can help with. What is your sagging, your sagging device? Like, what devices would you go to for, maybe some jowls or some loose skin? What device would you go to for that?
So I have two sagging devices.
Or non-sagging devices.
Yes, non-sagging devices. The first one that I tend to recommend most frequently for that specific problem is RF microneedling, is utilizing RF microneedling. Our device that we have is called the Agnes. It's a very, very strong device. And so it can really tighten skin in a very precise way. So for the jowling, I often use this device. It has a tiny, tiny little needle in it, and then it delivers heat through the base of the needle. So this needle goes into the skin, and then the heat comes out, or the radio frequency comes out the base of the needle. And therefore, the energy goes very deep into the skin and results in more tightening and lifting. So oftentimes people who've had a lot of weight loss or just aging in general, and they genetically have more jowls, I can use it in a precise way to reduce some of the redundant tissue here and then tighten the skin back here. So we reduce this, make it flatter, tighten in the jawline, and therefore define the jawline. And a lot of times this device will be used for patients who don't want to do filler. Best case scenario, we first tighten the skin like this, and then we use filler to strategically replace some of the structure and volume that's been lost. And that's really the best case scenario, will give us the best results.
Okay, that's really nice, because we talked about this before we started recording, about some of the RF microneedling, getting rid of people's fat, which if you're using it for redundant tissue, that's great. But when do you know where to use it and when not to use it? And what should people look out for, basically, if they're considering using this device?
That's a great question, because there have been reports of unwanted fat loss. So these devices are really great because, for instance, this one that I have can reduce fat, but in a way that I wanted to. So double chin area, jowl area, etc. There are some devices out there that have gotten too hot and have resulted in unwanted fat loss. And so again, I think this really underscores the need for someone you trust to be doing the procedure and picking the right device for your condition.
Right. Yeah. The same device can do multiple things. So, okay. And then you had mentioned earlier Softwave. Can you talk about the technology of Softwave and what it can do, what it can't do?
So this is an ultrasound device. It falls into that category of ultrasound treatments. And the device we've chosen in our practice is called Softwave. I love, love, love this technology because, number one, it's completely non-invasive. That means there is nothing going into the skin, not even a little tiny Botox needle is going into the skin. So it is strictly ultrasound waves that are focused and that go to a certain depth in the skin, and then they work their magic. And then the second thing that makes it so nice, especially here in Arizona, is that these ultrasound waves are focused to the middle part of the skin, or the dermis. And so the waves skip the epidermis. So there is no collateral damage in the epidermis, and therefore we don't have to worry about skin color and sun exposure. So safe in all skin types and safe if someone's been out in the summer, which is really nice. It makes it a very good summer treatment, especially here in Arizona. And so the ultrasound waves go in, they heat the skin, and that causes some collagen production. It causes elastin production. What does that do? It makes the skin glow. It makes the skin a little bit tighter on the surface because of the new collagen, and it makes the skin look healthier, just like the Fraxel, because the end result for each one is collagen production. But some of that heat also goes a little bit deeper and can actually heat the connective tissue, or the SMAS, connecting everything in the face. So we do get more lift with an ultrasound device because we can have the energy go a little bit deeper into the skin and tighten or lift this mass. And that lifts everything up.
Okay, that's really interesting. So when you're first talking about ultrasound, I'm thinking, oh, like when I was pregnant, there was an ultrasound, but it's different technology. It's heating.
Yes, exactly. And that has to do with the way that the ultrasound waves are targeted and focused.
Okay, so it's heating the deeper layers. Are there any other devices out there that go by name brand that do have that kind of an effect?
Yes, so there is also a device called Ultherapy that has been around for years and years. And in fact, the company just released a second version of it. And that's also widely available. We just happen to choose the Softwave version because we like the technology better and it gives an extremely predictable result.
Okay, how painful is this? Because I'm going to disclose that I had Ultherapy maybe 8 years ago, and it's the only, and I had children naturally with no pain medicine, so I thought I had a good pain tolerance. But when they touched my forehead, I said, I'm out of here. I don't care that I had to pay. I'm not having this pain. It was really, really painful. So, like, how painful is this? I mean, we're going to be real here.
This is real, and I'm so sorry to the Ultherapy company, but it is an extremely, it works. It is an extremely painful procedure, and that is also one of the reasons we chose Softwave over Ultherapy because it's much more tolerated than the Ultherapy. So I also have had children, but none of them were natural, drug-free childbirth. I like to be comfortable, and so I can do this treatment with no problem at all, and it's over very quickly. It's very tolerable. Jen, knowing you, you would probably be asking our nurse to give you 2 treatments in one day because you thought it was so easy.
Okay, thank you. I just had to get to the point because, there's so many good procedures out there. And I think people need to understand like the cost of things, which I know you can't really say because the cost varies so much by geographic location. So we can't really say, but I mean, most procedures in the laser world are going to run in the thousands. But also like the amount of downtime. So it sounds like with Softwave, there's not a lot, maybe a little swelling.
There's zero downtime with Softwave. And in fact, I think patients usually leave looking better than when they walked in. There's kind of this instant tightening that occurs. But like everything that stimulates collagen, you will see the best results after several months. So no downtime with Softwave. And again, this is something that can go into the cosmetic consultation. How much downtime is tolerable for someone? So if someone has some downtime, they want a really great result, we talk about the Fraxel. If it's summertime, they've got a lot of social events, or it's graduation season, Softwave is a really great option, and you start seeing the results right away, and they only improve over time. So yes, and then cost is also a factor, of course, for everyone. But the great news is with some of these technologies like the Fraxel, like Softwave, we don't have to do them frequently. In our practice, we recommend for most patients a Fraxel annually, and patients can do more than that or more frequently have the treatment. However, if in an ideal situation, they're doing other things, like you said, there's so many things out there now that we recommend and we ask patients to do. So if they're doing other things, I will often add to their mix Fraxel annually, Softwave annually. So these things may be costly initially in the low mid thousands, but you don't have to do them frequently.
Right. Yes, that's a good way to think about it. You brought up a point that I want to reemphasize about when we stimulate collagen. So while somebody might walk out and notice improvement a week later of their skin, we're still stimulating collagen, which takes the fibroblasts 3 to 6 months to form. So the results are going to be better 3 to 6 months down the road than they are a week or 2 later. So there's a little bit of patience involved in this, and sometimes not stacking too many procedures in a row and giving things time to work.
Yes, that's exactly it. And the The thing is when you're doing these lasers or energy-based devices that really do give these predictable results, you don't have to go crazy with the frequency of things. You don't have to be doing a lot of things. If you make the right investment, you can actually feel like you're pretty low maintenance and have wonderful, wonderful results. So again, that's something that should be discussed with your cosmetic doctor. It's really important to have a cosmetic doctor that you trust because they should be guiding you in that sense. And I have this conversation all the time. In fact, I think you and I may have even had this conversation before where I say, okay, well, you just have the Fraxel, then you actually don't need to do anything else for a while. And it really is nice to have that guidance when there are so many different options out there.
And I want to emphasize, don't jump from doctor to doctor, because if you have filler with one person, or I sent someone to you who had Botox with someone else because they shop around for the lowest price, and then they did filler with you and they thought filler caused loss of movement to their lips. And I said, filler doesn't do that. Did you have Botox? And they had Botox with someone else. So when you go to the same person, they understand everything that's being done to you and they can provide the best guidance. But if you're jumping around from person to person to person, that's where I see the most side effects and the most problems with everything.
Yes, and I remember that patient. And this is such an important point because your best care really comes from the trust and communication you have with your doctor. And you really are going to get the best results when you have that person guiding you through your skincare treatment, hands down.
Right. Okay. I want to be cognizant of your time, and I know you have to get your son. I just want to cover one more thing. The skincare prep before laser treatment and then post laser treatment, how would that vary from what somebody would do as their foundational skincare from day to day in general terms?
Thank you for asking that question. It is so important no matter what light-based device that you're doing, especially with lasers and IPL. It's important to avoid the sun before and after your treatment. And patients often do forget this, even though it's emphasized so much. But really what we want to do is have the color cells in our skin, have the melanocytes nice and quiet and sleepy. And when we're out in the sun, they get perked up. And then when they're perked up, sometimes they have this side effect when they have laser to release their color and cause hyperpigmentation. And that can be a really annoying side effect. In addition, if someone has a tan when they come in for laser, the laser is often stronger than it normally would be if someone didn't have a tan. And so the settings would need to be adjusted. The best and safest thing is to avoid the sun before and after. That's number one. Number two, keeping the skin as hydrated as possible. So many times we ask patients to avoid irritating products before their laser treatments like glycolic acid, retinols, etc. And that's because we want skin with an intact skin barrier. We want the skin to be non-damaged, nice and hydrated when someone comes in. Additionally, things like glycolic acid, retinols, they can make skin more sensitive to the sun. So again, we want to minimize sun as much as possible. And then afterwards, if someone is prone to hyperpigmentation, sometimes we will use a bleaching cream or hydroquinone to reduce the risk of hyperpigmentation, and sometimes even a topical steroid depending on the patient's skin tone and personal history with hyperpigmentation.
Yeah, I mean, everything you're saying is so complex, and I'm also thinking of so many more variables that can happen. So really, at the end of the day, somebody needs to go to someone who understands skin and the physiology of skin, because if you don't, even if you do the right laser and you don't prep it and post-care it properly, you're not going to get good results.
Yes, you're really doing a disservice to yourself if you walk in just kind of unprepared. You absolutely will get the best results possible if you have that consultation with someone who's qualified to do these procedures and heed their advice, right? Hands down.
I hear this all the time, and I just want to emphasize that's why I love going to you, because you give people a post-care kit and very specific instructions of what to do for a week after. And the last time I had Fraxel with you, I had a friend who doesn't live in town here who had, I think she had CO2 and plasma, and no instructions on what to do afterwards. None. And just
that is terrifying.
Mind-blowing.
That is terrifying to me. And maybe she had some verbal instructions, but to your point, I really do appreciate verbal and written instructions. And it's so important to know what you're supposed to be doing, what the signs and symptoms are of a complication, so that you can call your qualified cosmetic dermatologist or plastic surgeon, and that they can help you in an early phase versus letting a potential complication turn into that.
Right. Yeah, because these procedures, they have downtime, they cost money. So if you're listening to this, if you're an esthetician, if you're someone who's a potential patient, make sure you find out how to best prep your skin and then what you should do afterwards and when it's okay to return to your normal skin routine. So that's what we're trying to share here.
Absolutely.
Yeah. Okay. Anything else that I didn't ask about that you think we should cover?
One thing we didn't cover is scarring and how these energy-based devices, specifically lasers, can be so life-changing for scarring. So anyone who's out there who's struggling with scarring, we have so many options. The game has really changed, and we can be extremely, extremely effective with scarring, regardless of the cause: acne scarring, surgical scarring, etc. So if you're struggling with scarring, I encourage you to go to a cosmetic dermatologist or plastic surgeon.
Are you talking more about acne scarring where there's atrophy or loss of tissue, or hypertrophic? Do we have good treatments nowadays for keloids and hypertrophic scars, or they're very challenging still?
All scarring is challenging, but I really do think that we have made a lot of progress in the way we treat these scars. So I would say both types of scars are highly, highly treatable. Also burn scars and surgical scars. And in general, one important thing for the audience to know is the sooner an intervention is done, the better the end result will be. And that's because we can actually affect the biology of the scar and help to normalize the scarring tissue to make it as much like normal tissue, as non-scarred tissue as possible.
That makes me so happy because, we get to see how people feel vulnerable about things having to do with their skin and how we look and show up in the world. We're often very self-conscious about certain things that people don't often even notice because they're worried about their own things. But at the end of the day, if we can make someone feel better about themselves so they can show up in that job interview and ask the girl out on the date and do all of the other things that they want to do in life, that's really what it's all about.
It really is. It's a huge quality of life improvement to make someone feel less self-conscious about their scars. I love doing it.
Great. Well, it's so great. The technology is changing so much and things are just going to get better and better. And I appreciate you being at the cutting edge of all of this and sharing your information today, Brenda.
Thank you so much for having me, Jen. Yep. Really enjoyed it.
So if people haven't heard the other episode, can you just drop in the comments, how do people find you?
So our website is cleardermatology.net and our social media handle is @cleardermatology. We'd love to see you in the office. Thank you.
Thank you.
Thank you for joining us on Listen to Your Skin by Moon & Skin. It's an honor to be part of your skincare journey. And if you love this episode, make sure to subscribe, leave us a glowing review, and share it with someone who's passionate about their skincare journey. And please connect with us on social to ask your questions, which will drive future educational episodes.